We did our project on chemotherapy and used to treat brain tumors. Chemo is a cancer treatment that is made of chemical substances. Paul Ehrlich was the one who discovered chemo in the 1940s. He was a German chemist. The very first chemo was used to treat syphilis, which is a bacterial infection, usually spread by sexual contact. There are over 120 types of brain tumors. Chemo is really important to the discovery of brain cancer because brain cancer is the second leading cause for all cancer deaths with kids and young adults. Chemo is usually separated into many groups, but classified on how they react to different chemicals and their chemical structures. Chemo can be taken in several forms, like injection, where you receive a shot, intravenous, where chemo goes directly into your veins, intraperitoneal, where chemo goes directly into the peritoneal cavity, that's where your liver, intestines, stomach, and ovaries are, or intraarterial is when the chemo goes directly into your arteries feeding the cancer. Topically is when you get a cream to put on your skin, and orally like pills or liquids or capsules.
So basically, chemotherapy uses a lot of different toxic chemicals to kill the cancer cells. One of the main drugs that are used are the alkylating agents, and that's because they're known to damage the DNA to stop the cancer reproduction. Chemotherapy uses chemistry because they're trying to investigate how the chemicals will interact with each other so that they can discover new treatments to kill the cancer cells. The image that you see is a combination of the elements to make cisplatin, which is a prescription drug that treats many types of cancers. How does chemo know which cells to kill? Well, chemo doesn't know the difference between cancer and normal cells. So the chemo drugs are going to kill the cells that are dividing to stop spread. But the cancer cells are going to divide much faster than the healthy normal cells. So the chemo will most likely kill more of the cancer cells and rather than the normal cells. And that's why it's better if you start chemo fast, because so to stop the spread of the cancer cells. And multiplying cancer cells are going to lead to a lump, which we know as a tumor.
Oncology is the study of tumors, so an oncologist is a doctor who specializes in treating people with tumors, but not all tumors are cancerous. There are three kinds of oncologists: a medical, surgical, and radiation. The medical oncologists are the ones who give the patients the chemo and decide how much they need to help them. The surgical one is the one who removes the tumors and any tissue around it. And the radiation oncologist is the one that helps them through their radiation cycles, and that's when they zap the person with the radiation waves.
So those three different types of oncologists are usually going to work together to help patients cope through the cancer. Oncologists have a demanding job because it requires long working hours and the ability to give bad news to patients. So communication skills, and they need to help them make the situation less difficult. An oncologist have to go through a lot of specialized training. They must pass several state tests before they can take on their career. And they have to be very competitive because most of the medical schools are very selective of their students. The average pay for a physician or doctor oncologist is going to be $232,376 annually.
There are two main groups that chemo can classify under. The first one is cystostatic, and that's when the chemo is stopping or slowing down the production of the mutated cells. And the second type is cytotoxic, when the chemo is destroying the mutated cells. Chemo can be delivered either systematically or locally. Locally is when it's given right into the spot of the cancer, like right into the arteries. And systematically is when the chemo is placed in one spot and traveled throughout the body, like when you take the chemo pills and it's used to help treat brain tumors. Chemo can sometimes destroy the healthy cells, and that can lead to losing your hair, being very nauseous. You can bruise easily, get a lot of nosebleeds, and a lot of stuff like that. Chemo is usually recommended.
If you had pictures taken at the prom and have not.
Chemo is usually just recommended for the more serious kinds of tumors, but it can also be used for the lower grade tumors or benign tumors. Benign tumors are the kinds of tumors that don't affect the neighboring tissue, and that means the tumor is not cancerous. Chemo has many potential risks that go along with it while taking it. Your brain could swell, you could end up having seizures, you might not be able to have kids, you could have a stroke, go into a coma. If mixed with other drugs, you could have some bad reactions. Your memory could start to fade, you might have some balance issues, your organs could be damaged, and possibly death.